To apply the Dale abdominal binder, position the binder under the patient with a soft lining against the skin, the velcro fastener on the patient's right, and the seam at the center of the patient's back. Make sure that the lower edge crosses halfway down the buttocks and is low in the patient's pelvic area. Using the patient's weight as an anchor, stretch out the end of the binder which is on the patient's left and hold it in position across the stomach with one hand. With your other hand, grasp the other end of the binder in the middle, stretch it upward over the patient's body, and firmly engage the velcro surfaces. To adjust the fit, simply peel the surfaces apart and reposition them. The closure can be diagonally angled to conform to any patient's body shape. It's important to correctly and adequately stretch the binder. Remember, it won't restrict breathing. To the contrary, it's the stretching and compression which facilitates deep breathing. The Dale abdominal binder is ideal for holding wound dressings and accommodates the use of surgical tubes, as well as jejunostomy, chest drainage tubes, and G-tubes. Prior to applying the binder, surgical sponges or ABD pads should be placed on both sides of the drain to prevent excessive pressure on or occlusion of the drainage tube. If open system Penrose type drains are used, holes should be cut to accommodate the tubes. Begin by resting the binder over the drainage site. Be sure that the material is laying flat and that it's not doubled over. Mark the fabric vertically where the hole will be made. Crease the fabric and make a very narrow elliptical cut in the material. When the fabric is stretched, the cut will become a round hole. Cut away any loose fibers from the fabric around the area of the hole. The binder will not unravel and will retain its properties for providing support and compression, even if the cut crosses the gap-free stitching that joins the panels. Once the patient becomes ambulatory, the binder may be applied while he or she is standing. To do this, the patient or the nurse should position the top edge of the binder just below the navel, with a soft lining against the skin. Then stretch both ends out sideways. Wrap one end around, and then the other. Finally, press fasten the continuous Velcro closure and position the binder for an ideal fit. Patients may take their Dale binders home for continued benefits both during and after recovery. It fits inconspicuously under clothing to provide comfortable support as normal activity resumes. The binder may be gently washed by hand or machine with a mild detergent and air-dried, but be sure to engage the Velcro surfaces completely before laundering. With so many applications and so many benefits, both medical and economical, Dale abdominal binders are the obvious choice for hospitals and healthcare providers that want to take hold of patient care.